Right now, we're answering your calls about breast cancer health from MedStar health experts, and we have Emily Kuchinsky here, who's a certified genetic counselor with MedStar Health, to answer some of those questions. So the first question I have is, how much of breast cancer is inherited?
Yeah, so most women who are diagnosed with breast cancer have no family history of the disease. There's only about 5 to 10% is inherited. The most common cause of inherited breast cancer are the BRCA mutations, which a lot of people have heard of because Angelina Jolie and other celebrities have tested positive for these and had their breasts and their ovaries removed. But it's for good reason, because they increase risk for breast cancer up to 80% and also increase risk for other cancers like ovarian, pancreatic, melanoma, and prostate cancer.
Are there other genes that have been linked to inherited breast cancer?
There are. In the last few years, we've uncovered over a dozen other genes that are linked to inherited breast cancer. So a lot of women who tested negative for BRCA are coming back, and about 4 to 5% of those women are testing positive for these other mutations. So it's important to ask their physicians, if they haven't had genetic testing in a while, to be referred back because they might be positive for one of these other mutations. One mutation that we're seeing in a lot of families is CHEK2, which increases risk for breast cancer as well as prostate cancer and colon cancer. So men should definitely think about getting tested as well, because they can start their prostate cancer screening earlier, and both men and women can get screened for colon cancer earlier and more frequently.
Now, what are some of those red flags in the family history?
Yeah, well, first, take an inventory of both sides of your family. These breast cancer mutations are just as likely to come down from dad's side as they are mom's side. It's important to look for breast cancer diagnosed at an early age, so 50 or below, cancer in multiple generations, and also rare cancers like ovarian, pancreatic, or male breast cancer. This information can be scary to hear, but it can really allow us to detect cancer earlier if we know a family's at high risk, and maybe even prevent cancer. So knowledge is definitely power.
Something easy to do, to talk with your family members and figure out that family history.
Yeah, that's the first step. And I say the greatest gift that you can give your family is to write down that family history of cancer and figure out, is it ovarian cancer, is it uterine, is it cervical? Really figure out that family history.
Perfect. Thank you so much. And we're answering your breast cancer questions right now. Just call 410-671-0700.